Hello, I am Dr. Rebecca Stevenson, past secretary and president of the International Organization of Physical Therapists in Women's Health. Currently, I'm a women's health clinical specialist at the Newton Wellesley Hospital in Newton, Massachusetts. And we'd like to give you some information from a survey that we did entitled An International Survey of Women's and Pelvic Health Physical Therapy Organizational Practice.
And hello, I'm Dr. Jill Boysenalt. I'm founder and first president of the IOPTWH, and currently I'm an associate director and associate professor at Shenandoah University in Virginia in the Division of Physical Therapy. We'd like to acknowledge our co-authors, DPT students at Shenandoah University, Sarah Strong, Allie Kuhn, and Michaela Steckel. In 1999, 13 member organizations came together to form the IOPTWH in Yokohama, Japan. And the World Confederation for Physical Therapy then adopted the IOPTWH as an official subgroup of its organization. After that original meeting, the executive committee fielded an informal survey to the member organizations and developed the original scope of practice document. The goal of the document was to define the role of the organization and of its member organizations. It's timely to update that document as IOPTWH has undergone a name change in 2019 to the IOPTPWH, the International Organization of Physical Therapists in Pelvic and Women's Health. To do that, we've conducted a survey. We did a pilot survey and used the executive committee of IOPTPWH to validate that survey. We took their changes and developed the final survey, which we fielded using the Qualtrics platform to the chief delegates of the 30 member organizations of the IOPTPWH. The survey contains 3 main sections. The first is a demographic section, which asked questions such as how many members, individual members, were contained within each member organization. The second section asked the respondent to help define the patient populations that the member organization focused on: women, men, children, transgender individuals. And the final section, the bulk of the survey, was on system-specific categories such as obstetrics, urologic pelvic floor, the GI system, with some subcategories under each, such as high-risk obstetrics or urinary incontinence.
In terms of results, we had 19 of the 30 chief delegates responding to the survey. This did demonstrate in their responses that the member organization's scope of practice are evolving. All 19 member organizations reported that they treated women, 63% reported that they treat men, 42% reported that they treat transgender individuals, and 63% reported that they treat children under 18 years of age. Cancer has become a focus for many of the member organizations now, and specifics in regard to treatment for men and children has expanded since the 1999 document. For example, in the area of treatment of men, additional areas of focus included prostatitis, erectile dysfunction, orgasmic and ejaculatory disorders, and persistent pain. There are 3 potential impacts from this survey. IOPTPWH could use this as a foundation for a new scope of practice. The data could be useful for physical therapists in countries without a special interest group in women's and pelvic health as they develop such a subgroup, or for individuals to use as a guideline for development of a scope of practice. Additionally, current member organizations may use this information for strategic planning or for curricular guideline development. A big thank you to IOPTPWH for their assistance in the development of the survey.
And thank you to the Journal of Women's Health PT for this opportunity, and thank you for your interest.